Prostate cancer is dangerous because it's silent. It doesn't hurt and gives no signs until stage 4, when treatment becomes ineffective and the risk of complications is very high. You won't feel symptoms of prostate cancer until it's too late. In 70% of men, the disease runs completely without symptoms. In this video, you will learn the warning signs you must never ignore. I will also tell you about 3 main signs of prostate cancer that are frequently missed, and the real case from my practice. First and most importantly, prostate cancer doesn't hurt, and BPH doesn't hurt. Only prostatitis causes pain. Second, BPH does not lead to cancer. That's why the absence of BPH doesn't mean that there is no cancer, and cancer is not the result of BPH. However, prostate cancer development together with BPH is the most common situation. And this is what actually saves men, because they go to the doctor with BPH symptoms like a feeling of incomplete bladder emptying and residual urine, sudden and urgent need to go, difficult urination and a weak stream, and frequent urination, including nighttime trips to the bathroom. All of these are signs of BPH, not prostate cancer. Prostate cancer has no specific symptoms at all until stage 4. Let me give you a simple example. There are certain tumors that can be detected through self-examination, specifically by touch. Breast cancer and testicular cancer, for example, doesn't hurt and cause no symptoms, but you can feel them because they hurt like a small stone. Tumors only cause symptoms when they press on something important and disrupt normal function. For instance, pancreatic cancer can squeeze the ducts, blocking the flow of pancreatic juice and bile, causing pain, yellowing of the skin, and digestion problems. Now here's a key point. A 1 cm prostate cancer causes absolutely no symptoms, unlike a BPH of the same size. Why? Because prostate cancer usually grows in the outer region of the gland, while BPH in the center, compressing the channel, causing difficulties with the urination. And now a case from my practice. A patient came in complaining of nighttime urination. He underwent standard examination plus a blood test for PSA, a prostate cancer marker. This is the most important test for every man over 40 and should be done every year. And this is the only screening tool able to raise a red flag before prostate cancer symptoms appear. So my patient's PSA was 4.5. The next step was a prostate biopsy, which confirmed stage 1 of prostate cancer. So his nighttime urination was a sign of BPH, not a true symptom of prostate cancer. After all, prostate cancer has not a single specific symptom until stage 4. So listening to your body simply doesn't work for early detection. And here's the tricky part. There is no true normal PSA level at all. Yes, you've probably heard that PSA under 4 is normal, but there is not the full story. And now please look at the screen. This table comes from an international protocol showing that in men with PSA level between 3 and 4, the risk of prostate cancer is 27%. Between 2 and 3, the risk is 23%. Between 1 and 2, prostate cancer appears in 70%. And even with PSA below 1, the cancer risk is still from 5 to 10%. And here's the real challenge in modern urology. Among 100 men with PSA level between 3 and 4, 27 of them have actually prostate cancer, and we need to find them to perform prostate biopsy and prove it, while avoiding unnecessary biopsies in the other 73. That's why we have a number of additional tests to help both patients and doctors to make the right decisions, detect cancer early, and avoid unnecessary biopsies. And you may already know some of them. First, the ratio of free PSA to total PSA. If it's below 10, the risk of prostate cancer is high and the prostate biopsy is indicated. The Prostate Health Index is another test. It also uses ratio of free to total PSA, plus 1 another fraction called -2 pro PSA. Before the PSA era, the only way to diagnose prostate cancer was digital rectal examination. The reason is that a prostate cancer usually feels hard, like a small stone during the digital rectal exam. That's exactly why this exam matters. It's done strictly for your health. Prostate MRI also helps doctors decide whether a biopsy is needed. There is a classification system called PIRATES that allows estimation of prostate cancer probability. I have 15 years of experience at top oncological clinics, including Hadassah Hospital and European Medical Center. Need to find out your diagnosis? Link in description below. And now the main question: how difficult and dangerous is a prostate biopsy? Nowadays it's a routine outpatient procedure. usually done under light sedation, and the risk of complications is less than 1%. That's why the diagnostic power of prostate biopsy far outweighs any potential risks. Follow my Telegram channel. Take care and see you soon.